Dear colleagues, today I will present the third short video on psychodynamic psychotherapy. Earlier we talked about the start of this kind of therapy and the indication for it. Now we'll discuss some core issues of this psychotherapy. But to begin with, the intention of short psychodynamic psychotherapy is to cure a patient from his or her psychological complaints by discovering the unconscious, hidden determinants of the psychological disorder. We used to do that in couch analysis. It took us many years. Now there are enough techniques and interventions which make it possible to shorten the treatment, really shorten it. So, starting the treatment, the psychotherapist is directed at authentic expression of deep-seated motives, conflicts, desires, etc. In earlier, shorter psychodynamic psychotherapies had a focus, developed during the assessment phase. Now that focus is less important because it can change. What doesn't change is that you focus on the psychological back office. You try to help a patient get into his or her psychological back office, his deep-seated emotional life. So you do that by working on the resistance and the defenses that most neurotic and borderline patients are using. And in case of core neurotic patients, you can do that immediately as a defense analysis. In core borderline patients, normally we start with cognitive analysis. So let's focus on the core neurotic patients. You ask them to look inside and talk with you about personal feelings, deep-seated ideas, fantasies, dreams, uncertainties about their personality, about their intentions, and communicate as personal and as open and honest as possible. Of course, for a lot of patients, this is not immediately possible. It's more a paradox, but they try. And while trying this, during trying this, their anxiety level is raising. So they're getting more anxious. And as they get more anxious, their defenses are mobilized. As a psychotherapist, you see the defenses and you point to them. Two ways are crucial and make a fast uncovering process understandable. First, you have the character defenses. And you see the character defenses practically immediately in every patient coming into your office. One of the most well-known character defenses is that the patient is laughing. Not only smiling, but also laughing. while at the same time the topic of the conversation is serious. So that laugh is a cover. It helps to hide the underlying vulnerability. And then the technical aspect is that you look at the patient and you mirror the laughing. Mirroring doesn't mean that you start laughing yourself. No, you point to the laughing. So you say, I see you laughing. And that's it. Look what happens. Some patients will say, oh, I didn't know that, I didn't realize. And they produce more deep material. Other patients will say, well, oh yes, oh, and they go on. And they will laugh again. And then the psychodynamic psychotherapist will point to it again. I see you laughing again. Look what happens after that intervention. Normally, when you point to the character defense, you pull that defense into the consciousness of the patient. At that very moment, it doesn't function anymore as a defense, because a defense and defense mechanisms are unconscious. When you pull them in the consciousness, their function stops. And the underlying vulnerability, the underlying sorrow, grief, aggression, deep-seated anxiety, disgust, whatever, normally circling around what we call primary emotions, that underlying process, that psychological process, will get to the surface, and you are able to communicate about that in the here and now session. So, pointing to the character defenses. Laughing is happening all the time, but there are many different character defenses. Some words patients always use, for instance, you understand me? And they use that practically in every 3 or 4 sentences. Some characteristic movements, some that they make, gestures with their arms, postures with their body, and moving with the body. And also you can see that as character defenses, and you point to it. I see you're moving with your hands. I see tension in your belly. Your breathing stops or is very superficial. I see you pulling at the ring around your finger. What ring is that? Ah, it's your marriage ring. Okay, and you are manipulating the ring already during 5 minutes. What's happening here? What's happening with your marriage? Look at that at this moment. And so on and so on. You point to the character defenses, to the parts in the behavior of the patients that during their life became a psychological defense function, unconsciously. Pointing to it, shakes it, it loses that function, you pull it in the consciousness, and immediately in the micro process something pops up that is hidden and that is defended against with that character defense. Then you have to be very sharp. After you point to the character defense, immediately ask, if the patient doesn't do that him or herself, immediately ask, what's happening to you? What's coming into your mind? What do you feel now? Look at me. Talk about that. And then in the here and now interaction, you are able to have an authentic emotional reaction. So that the analysis of the character defense makes it possible to shorten the process, to deepen the process, and act with the patient very quickly in his or her psychological back office. A second way of stimulating this process is paying attention to the tactical defenses. And the tactical defense is understandable when you listen very well to the formulations and the language that the patient is using. For instance, when you make an intervention, the patient can say, "I think that might be so." And "I think" is not a direct reaction. "I think" means that the head is in between the belly of the patient and the psychotherapist. So then you react, you think, is it like that or is it not like that? So you ask the patient to make a choice and be clear and direct about how the patient is feeling. Some patients say, "I think I'm angry." You say very quickly, "Are you angry or are you not angry?" And then the patient is forced to be authentic. "I think I will do that. I will follow that advice that you gave me." No. Are you going to follow that advice or not? And what the choice of the patient will be is not our responsibility, and we are not in the lead in that topic. No. The only thing we like to produce is a direct reaction. "I think I will stop smoking." No. Do you stop smoking or do you not stop smoking? Do you keep smoking? Maybe I stop smoking. No. Tell me. Look at me. Be straight. Are you going to stop or not? And you force them to make a choice. And that choice can be both. When they say, "No, I'm not going to stop." Okay, well, that's fine. So we don't need to pay attention to that problem. And when they are choosing to stop, then you can understand, and also you can feel that they are motivated and they put all the energy in it. In the beginning of the treatment, you see this happening a lot. A tactical defense in the core is keeping the psychotherapist at a distance, at the interpersonal distance. Don't let the psychotherapist come close because he or she is dangerous. It makes me anxious if I have to be so clear and authentic. That's why patients use tactical defenses. And according to my experience, tactical defenses are the core issue in dropout or in stalemates in treatment. Your psychotherapy will not be deep enough, it will not be very successful if you are not able to analyze and overcome the tactical defenses of the patient. And there are all kinds of ways to do that. Also, a core technique is when you look at the patient and the patient is looking in all kinds of directions but not in your eyes. And the patient is defending in that way. A combination of character, defense, probably, and tactical defense. So I ask the patient, look at me. You ask your question again. Tell me, what do you feel at this moment? What do you really feel? I think I am a little bit annoyed. No. What do you feel at this moment? Look at me. Look me in the eyes. Are you annoyed or not? And asking the patient to look at you while they are talking and answering your questions, it produces a lot of running out of the defenses. It is very difficult for a patient to stay defensive and be guarded and look at you and reacting to your questions. And this interpersonal communication produces that the primary emotions in the here and now interaction within the psychotherapy. And what we need in psychodynamic psychotherapy is primary emotions in the here and now, that they can feel direct in your presence. And that can be aggression or disgust or shame or guilt, anxiety, love, whatever. All the primary emotions that we know can be hidden in the back office, and you can put them to the surface, bring them to the surface, some of these techniques, and have the patient experience that primary emotion in the here and now. And when they tell you, well, I feel angry now, then your first intervention is, where do you feel the anger in your body? Because the primary emotion in the here and now has a physiological component. When they tell you, no, it's not in my body, nowhere, then you can reply, then you are not angry. Only anger, you are only angry when you feel it also in your body. So most patients will say, well, I feel it on my breast, there's a pressure on my breast. Then you have the physiological component. Then you go to the cognitive components. Pay attention to that pressure on the breast. Try to go there with your attention. Focus on that breast pressure. Maybe it's pain, maybe something else. And tell me what comes to your mind. What images, what ideas, what fantasies are connected to this breast pressure. And they will talk about that. That's the second component of a primary emotion in the here and now, the cognitive component. Then there is a third component to explore. What do you like to do out of this experience of this breast pressure? What would your behavior be? What do you feel motivated to do? And then maybe the patient tells you, well, I want to run away. I want to leave the office. Okay, imagine that. Imagine that you leave the office. Tell me, what's happening? And by the way, look at me. Keep looking at me if possible. And so, the primary emotion is analyzed. And this part of the psychotherapy we call emotional analysis. Earlier we had the defense analysis. Now we have the primary emotions in the here and now, the treatment situation, and then you analyze the emotions. Together also with the cognitions that are part of it. Psychodynamic psychotherapist is also a cognitive therapist, a schema therapist, and works with the cognitions that are produced in the process, in the here and now process of uncovering. When this process is working adequately in the here and now, and when the patient will always try to get out again, and then you try to pull him or her back in that uncovering process. And next to the primary emotions and the cognitive aspects connecting to that, the schemas that will be uncovered and that are crucial in the psychological disorder. Also, the consciousness will enrich. Patient is becoming, in the here and now, conscious of what's really alive in his psychological backgrounds. He will or she will somehow discover that psychological material, emotions, cognitions, fantasies, images that are crucial as determinants of the psychological disorder. And this happens in the transference relationships, in the here and now with a psychotherapist. And your relationship with the patient is nothing more or less than a result of the primary attachment relationship of the patient. You help the patient to become attached to you by, amongst other things, analyzing the tactical defenses, the way to keep you on a distance. And when you are successful in getting that defense out of the picture, the attachment will become deep, will also be a corrective emotional experience for the attachment history of the patient. And in that attachment relationship of patient-therapist, the primary emotions, the cognitions, and the consciousness are there, and those four ingredients are crucial in the psychological changing process, in changing psychological patterns, even personality and character patterns. Okay, so for today that was more about the crucial working method and the essential aspects of short psychodynamic psychotherapy. And in the next video I will elaborate that. Thank you very much for listening today.